Hi everyone, this is Dr. Emily Howell from Ashbridges Health Center. I'm doing a few videos because we are closed due to coronavirus, and I just wanted to help people out with some of their concerns and that they can manage at home. Being a chiropractor with a rehab specialty, I'm very much about active care. So I always say to patients, the more you do, the less you see of me. But right now you can't see us. So this will be hopefully a decent substitution. Today I'm going to cover foot pain. The key is, remember, with any of these videos, stretches, that kind of thing, is not every exercise is for everyone. So please check with your healthcare provider to make sure it's right for you. So with us all being at home right now currently, and often my patients when they're on parental leave, I usually recommend first off making sure you wear a pair of supportive shoes in the house, because right now we're in the house way more than we usually are. So either a nice Birkenstock or a running shoe that you can clean the soles off, and those can be your house slippers. That'll make a significant difference of just supporting your foot comfortably. Whether you have plantar fasciosis, plantar fasciitis, you could also have another condition I'll discuss, but tight, sore feet, there's lots that you can do. So first I'll show you some stretches, some exercises, and then recommend some home care. But again, make sure you check with somebody because it might not be right for you. So first off, I always mention that the connection between your feet and your calves and your hamstrings are very connected. So if your calves and hamstrings are tight, which a lot of us are, especially from so much sitting, you'll need to release those. So a downward dog is a really simple way of doing that. Just make sure you get your tail up and you can keep your knees bent. You can cycle them out or just a straight one. And make sure your back is nice and flat. If you have to do that to bend your knees, that's fine. The one thing also you want to work on is a calf stretch. So you can do it straight off a stair or against a wall or straight on the floor. The one part I always recommend that I learned from a chiropodist at my old office is try the 3-part stretch. So try outwards, straight, and inwards. Often what we'll do in yoga or stretching is we'll actually stretch the loosest part because it's easiest. So try all 3 positions and see which feels like it burns a little bit more. Not burns, but feels like it needs it. Next, I'm going to recommend for home care, I really like these wild toes. I wear these every day at night. They basically go between your toes. They're silicone. I have a bunion, so I found these to be very effective at just passively stretching the fascia of my toes, especially when I've been on my feet all day at work, as well as a heavy workout at the gym or a big long walk. I really enjoy them. I think they're super comfortable and they are really, really easy to wear. I'll usually wear them when I'm reading in bed or when I'm doing yoga or walking around the house a little bit. If you need a pair of these, we do have these on hand, so I'd be happy to slip them in the mailbox if you want to come pick them up at any point if you're having some foot discomfort. They come out of a company called the Foot Collective in Ottawa, so you can also email them on and order them online. Next, for home care, I like rolling out my feet. So this is actually the ball that I got. I got a set of them at Winners for like $9. You can probably order them on Amazon, and you put them under your feet, and I do a lot of rolling underneath them just to break up some of the tension and the adhesions in your foot. If you don't have that though, I often recommend a Gatorade bottle or something that has bumps, and you can even fill it with water and freeze it and then roll that. Something with some texture to help roll your feet out. The running room also carries like a nice knobbly stick. There's all sorts of options, but that usually helps it make it feel a lot better too. In terms of some exercises for your feet, mobility is a real issue with our feet in a modern society because we've worn shoes since we were tiny and often don't go barefoot. So I borrowed these exercises from some of my rehab course, as well as a colleague of mine, Dr. Andrea Spina. He has a great video on this as well on YouTube, but I'll demonstrate them. Pardon my feet. But basically what you're going to do is you're going to work on, I'll back up to make sure you can see them. You're going to work on lifting all 4 toes while keeping your big toe down, then lifting just your big toes and keeping your 4 toes down, then opening your toes and closing your toes. And last but not least, you're going to work on towel scrunches. This is an old-fashioned one, and you can do 1 foot at a time or both. And this helps to basically build up the intrinsic muscles of your feet. So you flatten out the towel, and then you do toe scrunches until you get to the end. That's going to help build up the intrinsic muscles of your feet, or the abs of the feet, to help build it up. So yeah, if you have any questions, let me know. I'm going to demonstrate one more exercise, pardon me, against the wall here. So you're going to stand against a wall and roll your foot inwards, connecting to the wall. Hopefully you can see that. You're going to do a nice wide lunge, and all I want you to do is kind of press your foot into the wall and side lunge away. Do about 10 of those. You can hold it for a couple seconds. And basically what that'll do is, often it's not actually plantar fasciosis or fasciitis that you have. It's a nerve impingement that runs through your foot down into your fascia. So try that as a variation. If you have any more questions or concerns, or you were wondering if these are right for you, either see your healthcare practitioner or you can message or email me. So thanks for watching, and I hope you're doing well, and I'll look forward to seeing everybody when we're all done with this. Thanks so much, and be well.